nuclear medicine test. Nuclear medicine test to check the cellular function. So, ultrasound, Gray, Doppler plus nuclear medicine test. All are, it is called, they can rule out the testicular torsion. If nuclear medicine, let me show you. When the nuclear medicine, that is a radioisotope, okay, it's a radioisotope is injected into the blood and it goes to the testicles, and the testicular cells receive that radioisotope inside the cell, and you took the picture, means X-ray, then you see that radioactive isotope are inside the cell. So then you can say, how did you get it inside? Definitely the cell is alive. If cell is not alive, then you will see the testis not taking any radioisotope. Okay? If half of the testis is taking radioisotope, you will see this. And half of the testis, you don't see radioisotope. That means it is dead. So, anybody will keep half like that or half like that? No, you cannot keep it. You can wait couple of hours more, say miracle can happen. But usually when the testis die, this area will die, this area will die, this area will die, this area will die. And when the dead part you see, it will be more hypoechoic. Because when the tissue die, means necrosis. There are no cellular activities and there is a fluid collections. More edema, more fluid lives over there. So that looks like that. See, if you see like that, it means the necrosis and cellular deaths are there. So it can confirm you that this testis is not savable. So now you click the color, right? Do I need to increase the color? No, you increase the color, there might be a color, but don't increase such a way that artifact is there and if we feel like, oh, it is live, there is a color. No, don't do that. And if color is not coming with the color Doppler, color only, then use power Doppler. Click the power Doppler, then you will see if there is a little flow even in the capillary, the power Doppler is working. If there is a color in the color Doppler inside the testicles, then you should call right way and they will take the patient to the ER right way and they will open and they will untwist. They will observe. When they do the untwist, then what happened? Immediately the testis will be red, right? Because the blood is flowing inside. When there is a torsion, the vein will be collapsed first. Because vein is low pressure. It will be tight first. When the vein tight first, then vein will talk to the artery. Artery, I cannot return your blood. Then finally artery will say, yes, I understand. I am understanding because I feel the intertesticular pressure, resistivity index is going high. And I am having difficulty to send the blood into the testis. At one time, the testis also fail, testicular artery will fail to supply the blood to the testis. So testis will die. Okay, keep that in mind. The left testicular venous return and right testicular venous return are different. Left testicular vein, it drains blood into the left renal vein. Right testicular vein, it drains directly into the IVC. Okay, so now I will discuss the varicocele, then I will discuss the malignant diseases of the scrotum. Varicocele. Varicocele is a varicosities. You know what is varicose vein, right? It develops in the lower extremity, dilatations, abnormal dilatations of the superficial veins, tortuous. And the varicocele, then you have to know the little anatomy first. This is the scrotal wall, and this is okay. These are the two spermatic cord, and the veins so these are the veins, they see, that's the way the vein drains blood from the scrotal sac, and it goes around the spermatic cord, making the network. That's why its name is pampeniform. Pampeniform plexus means just like a net distribution, as if it is a net. So this pampeniform plexus, just now understand, I'm just giving you a little more. Look at here. That's the way the vein forms, right? That's the final vein. So now, can I say that this blood is also passing through this channel? Can I say that? This blood is also passing through this net and is the same blood. And if there is, number one, if there's an obstruction here, obstruction, then what's going to happen? All the veins will be back up, right? But usually the vein has valve. So vein usually the vein has the valve and the blood is passing through this way, and when the blood is passed after the valve, so this is valve cusp. The whole thing is a valve, and this is called sinus, and this is the flow directions. When this blood will pass after the valve cusp, the cusp should be closed. The cusp should be closed like that, and this valve will be closed so that this blood cannot go back. But if this valve cusp did not get closed, then what happened? This blood will go back because here the pressure goes up. Pressure goes up. Automatically this blood will go down if the valve is open. So when the blood goes down, then what's going to happen here? It will be dilated. That is called incompetent venous valve. Some people born with that incompetency of the valves. Incompetency of the valves. When the valves are incompetent, and if this person is standing, working more, carrying the heavy weight, and obese, or having constipation or bearing down, then what happened? Like a Valsalva maneuver. The blood will, because the valves will be collapsed, and all the blood will move down because the valves are incompetent. And this tympaniform plexus will be dilated, dilated, dilated. So normal diameter is less than 2 millimeter. But if it is greater than 2 millimeter, some book says 2.2 millimeter, so then we call it varicocele. And this varicocele is in the scrotum, and this varicocele, when it is dilated, it becomes tortuous like this. And when it is dilated and looks like that, so it feels like a bag full of worm. A bag full of worm fillings. That is varicocele. And this varicocele is one of the main cause of male infertility. One of the most common cause of male infertility is varicocele. But the good news, it is correctable. A surgery can remove this varicocele and that couple can have babies. So that's why it is very important. So if you see this sonographically during the scrotum question, where are you going to see? At the bottom of the scrotum or above the upper pole? Above the upper pole. Because this varicoceles you will see above the upper pole or above the head of the testis, epididymis, you will see the multiple anechoic tubes. Some of the tubes you will see elongated, some of the cross section, because it's all directions. Then you have to click the color. Then you will see, oh my God, it is more than 4th of July. So colorful, different color. So then you have to measure anechoic area only inner to inner. AP measurement. AP means height. Okay, so then that means if you want to measure, if this is your image, then in transverse view, when you go above the upper pole, then you will see okay, this type of area, that some area has anechoic. When you see the anechoic, click the color, it will be colorful. And then measure the AP measurement. Okay? If this is the blood vessels you found, you have to measure inner to inner. That is AP. Okay? Then you have to see how much is it. If it is greater than 2 millimeter, then take it as a varicocele. Okay? So this is general pathology. Then intertesticular malignancy. That is very important. Let me discuss those things. Intratesticular mass. They said 95% cases in all intratesticular masses are malignant, unless otherwise proved. So what are the intertesticular mass? You can see number 1, seminoma. Embryonal carcinoma, choriocarcinoma, teratoma. So these are the 4 major type of cancer. This is the most common. Most common is seminoma. The good good news is seminoma is radio sensitive. That means radiation can cure 100%. But it has to be before the metastasis. Okay? So seminoma, most common, intratesticular. It arises from that spermatogonia of the seminiferous tubule. Most common homogeneous solid tumor, clear border, hypoechoic, okay, and radiation sensitive. That means radiation can cure the tumor. Okay, this I'm giving the summary. Now, embryonal carcinoma, the age group, any age group, but not the young, usually adult. Embryonal carcinoma, by the name embryonal, it feels like it's a younger age group, right? Embryonal, yes, write down. Younger age group. More aggressive. More aggressive. It feels like it's going to grab the whole testis. The borders are not clearly seen. Borders are not clearly seen. Borders are irregular and not clearly seen. And it is non-responsive to radiation. And alpha fetoprotein AFP will be elevated. Keep that in. Alpha fetoprotein is a marker for cancer. Liver cancer, ovarian cancer, then testicular cancer, alpha fetoprotein will be increased. Okay, so then when this is very aggressive, then it needs more food, right, to grow. If it does not get more food, then necrosis is started. When there is a necrosis, then you will see hemorrhage. Hemorrhage or anechoic area, cellular death. Okay? The seminoma, if you want to see the seminoma, this is testis. So homogeneous, clear border you can see. This is seminoma, okay, hypoechoic. And embryonal cell, embryonal carcinoma, so you will see this is testis, see how irregular the border is. And it tried to grab all the testes. And there might be a bleeding, hemorrhage. Because it's aggressive. It is aggressive, embryonal carcinoma. Now, choriocarcinoma. Choriocarcinoma is a rare type. Choriocarcinoma is the same tissue called placental tissue. Usually mixed histology, pure form is very rare. Mixed tissue, you will see multiple different types of tissue. It is highly malignant and widespread metastasis. Highly malignant and widespread. See, this is highly aggressive. Look at the key word. There, those are the questions. Seminoma is a common. Radio sensitive. Right? It could be cured by radiation. Embryonal, younger age group, highly aggressive. It wants to grab the whole testicles as quick as possible, and alpha fetoprotein is elevated. Choriocarcinoma, so it is malignant, highly malignant, and is a rare, is a mixed type of tissue because the placental tissue is there, and highly malignant and widespread, and beta HCG hormone is produced by this tumor because of the placental tissue. And beta HCG is a man hormone or female hormone? Female hormone. It associated with pregnancy. That's why if it's going to happen to the man, is a boy, they will develop gynecomastia. And if you do the pregnancy test positive, then you will see the boy has a pregnancy test positive. Okay? So, you need to know that because of the beta HCG is elevated, so gynecomastia will be present and pregnancy test will be present. Okay, so this is This is age group is 20 to 30, younger age group. And again, if the tumor grows bigger, is a small mass, no testicular